Okay. All right. We'll go to our next speaker now, uh, who is a patient, a caregiver of a patient, father of a patient, Bill Lundgren. And so many of us, as we learn down the road in our journey, we learn things that we wish we'd known when we were first visiting our doctor or deciding on a treatment plan. And we just asked Bill if he could give a patient's perspective on what would I do differently starting the journey with his beautiful young daughter. Bill, go ahead and please, and I love the slides you have because they show his beautiful daughter, but really describes a difficult journey that he's learned from, and I hope we can all learn from.
So my name is Bill Lundgren, and I'm father and caregiver to my daughter along with her mom. So meet Susie. So Susie's a wonderful young girl. I'm biased, but I think she's super awesome. Susie, when Susie was born with her left calf was slightly larger than the others. So at the time, this was in 2006. So at the time, the doctors here in Dallas were like, "Oh, that's a sign of an abdominal tumor." We're like, okay. So we had her scanned and prodded till she's 5 or 6 years old. And based on everything that came back, they said, well, it's just an asymmetry. There was no symptoms. It was asymptomatic. Her one calf was slightly larger than the other. Well, in middle school, when Susie hit puberty, her left heel started to raise off the ground. And at that time, we had the unfortunate diagnosis that, in fact, Susie had a desmoid tumor. So we reached out and we were recommended we were given a quote unquote surgeon that knew all about desmoid tumors. And so he says, yeah, I have experience with tumors, and we can, as Dr. Pollack had mentioned, we can remove it with clear margins. And since she's had it her whole life and it hasn't moved, it hasn't done anything, there's a high probability that it won't come back. I'm going to try to gather myself. So 3 months later, it came back larger, more aggressive, and it quickly began to wrap around the rest of her calf muscle and continue to pull her heel into a locking position at much like a ballerina point. Her foot cannot be extended any further than it is today. So, okay, so now we're in it, right? So we've tried multiple medications. We've tried multiple treatments. We started with chemo. We've tried it with different, forms of pill forms of medication, sorafenib. We've done nirogacestat. We've done high frequency ultrasound. We've been in several clinical trials. And on top of the medications, and it's the side effects that go along with the medications, right? So then it's this constant juggling act. It's now we're trying this new treatment, so that then introduces a plethora of side effects that then you have to take additional medication to counter those side effects. So Susie's now 16, and her backpack looks like a pharmacy. So Susie has been in a wheelchair for almost 4 years now. The last medication dropped her bone density to an all-time low, and just a simple act of trying aquatherapy, of moving a cone underwater, it had fractured her fibula at the point of where the tumor was pushing on it. So, game on times 10, pain, unable to put any weight on the foot whatsoever. And so that's where we are. And why are we here, right? Because 40% of all desmoid tumors are misdiagnosed. And you can or cannot quote me on this one. This is kind of the terminology. I know there's some research that will back some of this up. But, when you are diagnosed with a quote unquote tumor, the chances of actually being diagnosed correctly are not extremely high. So what would we ask our oncologist if we could do it all over again, right? So before I ask my oncologist anything, I think there's a checklist that we all have to go through. First of all, this is so rare that the odds are that your oncologist has never heard of it are kind of high. So you need to educate yourself, because no, it is not fun being the smartest person in a room full of doctors. And how do we do that? And I say that, I don't, it's no discredit to our medical community, but it is a rare disease, and the chances that your family doctor knows about desmoid tumors are very low. So what can you do? The best thing you can do is educate yourself. So obviously the Desmoid Tumor Research Foundation, DTRF.org, is probably your best and main place to get as much information as possible. SpringWorks has also launched their new site with desmoidtumors.com. And you don't have to be a scientist or a doctor to truly understand what you're dealing with, but you do have to familiarize yourself with the terminology, because in your conversation with anybody who's going to offer some kind of treatments, there's questions that you can ask, and there's things that they're going to say to you that you at least need to have some familiarity with, because you don't want to be, cross-eyed in a meeting like, I have no idea what you're talking about. You really have to do your homework. And so what are your options? Obviously, Dr. Pollack just went through quite a bit of great information on your options, but can you wait and see, right? Where is it? Now, Susie's case, it was an extra abdominal tumor. So it was becoming active and it was starting to impede, mobility. So we had to do something, right? There are also obviously a ton of chemo options, right? And I can't even pronounce most of them. And then there's obviously there's oral medications that are coming out, and they're coming out all the time. And also alternative procedures, obviously we mentioned cryoablation, there's TACE, there's HIFU, transpartial radiation, etc. And if you don't know what these are, that's another reason to at least educate yourself, right? And then what clinical trials are available to you? And are there surgical options? Should you do surgical options? So there's this diagram that I'll show here on the screen that I think is just key. I wish we had this from the get-go. This is on the Global Consensus paper from 2018. It's listed on the DTRF.org site. Really, it's kind of a flow chart. So you're diagnosed. Okay, so what do we do? Is it abdominal? Is it intra-abdominal? Is it an extremity? Where is it? Head and neck? And so what are your different options based on that? So you have to have at least know what your options are. And then you need to formulate a team. Odds are that your oncologist is going to have all the information for you are also a little rare. So you need to find an accredited sarcoma specialist that truly has experience in desmoid tumors, and ask them how are you experienced, right? Not just, well, I know about it. It's probably the worst answer you want to hear. And also, just because your oncologist is local doesn't mean that, no discredit to them, doesn't mean that they're the appropriate oncologist for you. You really have to do your homework, and you find a multidisciplinary approach. Right, you need a team that's going to try all aspects of treatment, right? And ask other patients for referrals and advice, because it truly, I hate to pull this quote, but it does take a village to diagnose and plan to treat a desmoid tumor. So what does a team look like, right? So in our particular case, we have an oncologist. I think we're very lucky that we have an oncologist that's connected to the greater community and is connected to the desmoid tumor community. Obviously a radiologist, and in Susie's case, we need an orthopedic surgeon to understand, what we're looking at structurally. Palliative care for pain management. Obviously, there's nerve damage. I could be pushing. It could cause other type of or pain, nerve pain. So how are you going to manage that? Physical therapy, something, specifically for Susie. How are we going to lower her heel? How do we do that? How do we maintain range of motion? A dermatologist, and some of the medication she's been on has been just, very hard on a young girl, and she's become a skincare professional at this point. A dietitian, what kind of food should we stay away from? What kind of food should we eat? And a psychologist. That's been very key for Susie as well. And physical medicine and rehabilitation specialists, right? So we made a mistake of just, let's just get a wheelchair. And then by the time we've already been in it for a year and a half, then we had, found we could get a better one. And they were like, I wouldn't put anybody I know in that wheelchair. I'm like, oh, sorry. So, we resurrected that part. But so what's a game plan? You have to make a game plan. And when I say that, everybody has to be on board. You have to make it together with your oncologist, with your team of doctors, with your patient, with the caregivers. And what is your plan? If your option, don't go by the options that are just locally available to you. It is worth taking a drive or a flight if something's really going to be a game changer for you. And what's your timeline? And so this is a balancing act. How long can I endure a particular medication? Because we know some of them, the side effects are very rough. But at the same time, how far can I go? How soon can we tap out? Don't stop too soon, right? It's almost like the bell curve. Like a lot of this, the side effects are kind of ramping up and you're getting used to it, and then you kind of, get used to some of the symptoms, and then you kind of get over the curve, and maybe it's a little bit more manageable. You have to take that balancing act. And then what is the risk versus reward? So we don't, you have to look at what your treatment options are, and how risky is the treatment, what's the reward? And most importantly, you can't go it alone. And I know that's probably one of the hardest things for this disease, because people feel like they're on an island. This is so rare. They really don't have anybody in their local circle to talk to. So one of the game changers for us is finding the Desmoidian Facebook group. We found so many great people, and just being able to get advice, and people just want to vent. Some people just need, just to hear somebody just say, hey, I hear you, I'm in your corner. And connecting with other patients that have a similar situation as you, right? Because desmoid tumors are also very different. There's some people on Instagram, that are having some that post their journey. We found some great people that, are close to us, with, finding somebody on social media. There's also testimonials and videos on YouTube. There's a wide range on YouTube. So that, that's the wild, wild west there. But I highly recommend, reaching out and getting connected, and don't give up. Stay connected, keep focused, stay present, try not to think too far. Sometimes the light at the end of the tunnel is really hard to see. Excuse me. Volunteer, fundraise, go outside of yourself and try to help others. That'll help you. And then you need to center and find yourself, whether that's prayer, whether it's meditation, whether that's exercise, whatever it is, you need to find a release. One of the silver linings here is that, Susie's been somewhat immobile, I should say. She's become a great movie buff, and she knows more about different film movements and directors and, actors. And, I think in the silver lining here is that, when she's looking at college, we're looking, something along the film degree. So there are some silver linings here to take away from it. So I also want to say that in the 4 years that we've been in this, 2 drugs have come online since we've been here. There's clinical trials still coming up. There's new treatments that are available all the time. I really feel that we're at a great point in time where medical advancements are happening all the time, that I truly feel confident that we're going to find a cure soon in our lifetime, and then and in the coming future, and we can't lose sight of that. So thank you so much. You're all warriors, and I appreciate your support. Thank you.
Bill, thank you so much. We don't have any specific questions for you in the Q&A, but just comments. Thank you for being so brave to speak openly about, you know, this vulnerable situation that we all deal with the emotions of this. And I think you had some great suggestions on things that can help us along our journey. So thanks so much for your presentation.